So far, we've created a database, created a patient file, and created test sequences. The analysis and report sections are where you're going to see the culmination of all of our work. Here's where you'll see the true potential of Northstar as a time-saving evaluation tool. The first thing you'll see when you open Analysis is 4 categories on the left: Test Results, Summary, Test History, and Acute Whiplash. Test Results is where you'll find data collected from all of the tests you've completed, which are available here for review, organized by device and body part. As you can see here, this gives you a quick, easy way to determine efficacy of treatment and progress. Data for any tests performed will auto-populate here. There's more to Analysis than reviewing data, though. Let's click the Summary tab here. This section will be particularly important for evaluators performing functional capacity evaluations. You'll see a list of options in the list below: Summary and Recommendations, Functional Assessments, Reliability of Effort, Reliability of Symptom Reports, and Perceived Function. Summary and Recommendations is where you'll detail your final determination on the patient's demonstrated ability and your recommendation for the referral source. Anything you enter in these fields will show up under the summary header on your reports. If you're using the default template layouts, that means this information will be on the first page of your report, so it's an excellent way to get your determination at the forefront of your report. Functional assessment is where you can quickly update and review the patient's functional objectives, job demands, and demonstrated ability, and other functional capacity evaluation-related determinations. In reliability of symptom reports, you can make a determination of whether the patient showed appropriate responses during testing, and this section will also show you any data collected on subjective pain indicators recorded during testing. Reliability of effort gives you the ability to quickly note your determination of the patient's demonstrated effort. And again, like reliability of symptom reports, will collect any notes taken about high-effort behaviors during testing. Perceived function. This section allows review and assessment of the patient's reported perceptions about their own functional ability compared to their demonstrated or biometric results, such as rating of perceived exertion or spinal or hand function sort questionnaires. Test history will allow you to review test data for multiple visits to quickly review patient progress. You can select from a range of dates to include as many or as few patient visits as desired, and you'll be able to see changes between visits on a graph or as a percentage. The Acute Whiplash module is characterized by a number of categories identified by whiplash specialist Dr. Arthur C. Croft after review and analysis of nearly 2,000 cases of whiplash injury and whiplash-associated disorders. The guidelines provide an estimate of the duration of care as well as the frequency and number of visits that might be expected throughout the case. Care providers, third-party payers, independent examiners, patients, and others could all realize benefits in the face of complex whiplash-related cases. Take note, though, that these guidelines should only be used as a reference. Clinicians should use their own judgment and should look at all of the evidence in recommending treatment guidelines.